If you have a diagnosis of dementia or cognitive impairment, you already know that most medications for dementia may only have a modest effect on the symptoms. That is why it's important to talk about non-pharmacological interventions. Hi, I'm Debbie Cadendo. So what are non-pharmacological interventions? Non-pharmacological interventions are techniques or actions that we can use to manage disease or improve our health that do not involve the use of pharmaceutical drugs. They're used for a broad range of health issues, including high blood pressure, arthritis, pain, and dementia. Today, we're going to take a brief look at how they're used in the management of dementia. Non-pharmacological interventions treat all types of dementia. They're intended to improve factors like quality of life or interest in activities, or symptoms like agitation or apathy that impact people living with dementia. Another name frequently used for them is psychosocial interventions. It is widely acknowledged that non-pharmacological interventions are not used as widely as they should be. They can be used alongside and in some cases replace pharmaceutical interventions. In the United Kingdom, guidelines issued by the health regulatory body, the National Institute of Healthcare Excellence, or NICE, recommend non-pharmacological interventions as first-line interventions for dementia. In other words, they should be used first and are preferred as a method of managing any symptoms associated with dementia. For most subtypes of dementia, they may be the only option available. Dementia can affect a person's behavior, ability to make sense of their environment, and their physical function. Symptoms may include aggression, anxiety, and agitation, commonly called challenging behaviors or behavioral and psychological symptoms of dementia, or BPSD. Issues with cognition, a broad term that includes memory issues, difficulty producing speech, difficulties selecting and recognizing words, difficulties with organization, reasoning, and impaired perception, which will result in difficulty accurately judging distance and depth, and physical challenges such as frailty, difficulty with daily activities, function limitations, or disability. Dementia looks different in every person. No two are the same. Each non-pharmacological intervention may impact one or more than one of the symptoms we've mentioned. Research has shown that these interventions are safe and effective. For best effect, they should be used as recommended. If they are used consistently and appropriately, they may help prevent or decrease the frequency of crisis states. Intervention should be started before the patient is displaying any signs of crisis, because at this point, they may not be as helpful. Now let's look at the types of non-pharmacological intervention. There are many non-pharmacological interventions to choose from. Some help the caregiver, others help the person living with dementia, and some help both. Some well-researched interventions are diet, garden therapy, animal and robot therapy, music and touch therapy, as well as talk group therapy, reading activities, various types of exercise, physical therapy, occupational therapy, speech therapy, and traditional and complementary medicines, some of which may be given in doses that resemble recognized drug agents. One technique called cognitive stimulation therapy has sufficient evidence to show that it improves cognitive symptoms. It is used all over the world and is included in NICE guidelines. Most research has been done on the impact of these interventions on cognition. However, as we have said earlier, the people living with dementia have several needs that are very individual. The intervention chosen should match the symptom it's selected to address. For example, agitation improves with aromatherapy, cognition with cognitive behavioral therapy or cognitive stimulation therapy. Physical function and daily living activities are helped with physical therapy, and speech difficulties require speech therapy. Many non-pharmacological interventions have an effect on more than one symptom, and all have an overlap effect on general well-being. Non-pharmacological interventions can be used in combination. They should be selected based on the person's needs and preferences. They can be discontinued if not well tolerated. Because they're safe, you can experiment to see which ones are the right fit, but to see the effect of the intervention, it should be used for at least 6 months. If you find interventions that you like and tolerate well, you can continue them indefinitely. So let's summarize what's been said. Non-pharmacological interventions are also called non-drug interventions. They are recognized as first-line treatment of choice for dementia symptoms. They are effective and sometimes may be the only option available. They can be used with all types of dementia, and there are a variety of options. More than one intervention can be used at a time, and selection is based on whether or not the intervention is a good match to symptom and tolerated well. Finally, consider asking your healthcare providers for more information about non-pharmacological interventions. I provide cognitive stimulation therapy and many more interventions, some of which can be taught and continued independently. Thanks for listening. If you have any questions, I can be reached at homecareforja@gmail.com.